Hey, you guys. Hello. All right, so I was doing something. I was actually on Twitter, so wasn't paying attention to the time, but it is time, so let's go. Make sure I got my glasses together, cause let me clean these. What?
I'm covering up a little pimple I got.
Okay. Hello, you guys. Come on in. Yeah, I told you guys we would be on noon today, so make sure you share this out. I'm cleaning my glasses real quick. I move my desk over here by my window so I get to look out at nature. But hello. Hey, Rika. Hey, girl. Look, I know my hair's just up in the bun today. My edges is all what they gonna be. Gray hair in full effect today, okay? It's what it's gonna be today. Hey, Regina. Hello. Making sure my glasses clean so I can see. Hey, Erica. Hey, you guys. Look at that. Oh, wait. What did I say? Look, now I'm using the glasses to see. Oh, 3-year badge. Okay. Regina. Hold on. Regina got a 3-year badge, too. Hold up. Let me see what that say. Regina has a 3-year badge. Erica has a 3-year badge. Hey, Angel Girl. There go my Sherry. Hey, Sherry. Hey, Thelma. How are you doing? Let's see. Hey, you guys. So we are keeping it going. I told you guys we were going to start this year off doing our 100 question and answers about HIV and AIDS. So here we are today. If you've missed the first 2 lives, you can go back into the replays. Or if you go to my YouTube channel, I have a folder I created for it. You can go there and watch them as well. So today we are going to be talking about questions 27 through 34, which is really going to be talking about starting treatment. Now, again, this is not just for people who are HIV positive. This is for you guys who are also negative, because as someone who is an ally is someone who is in support of someone who is dealing with the HIV and AIDS virus. So if you're an ally or some type of support system for someone who is HIV positive, this information is for you as well, because you'll be able to answer questions if you're ever approached by someone asking these things. You won't just be like, oh, I don't know. This would be some knowledge you have, okay? So, yeah. Hello, Ruby. Sherry said, shared to my story, part 3 of the questions. Yes, thank you so much for sharing. All right, let me see. Hey, Rita. Hey. Myla. Can you bring me Oh, I knew she was going to stop right. Bring me a water bottle. Every time I say Myla's name, the dog barks. It's like she's the Myla alarm or something. I don't know. Myla. The dog just barks and goes crazy, bro. Okay, she did. She made it. Okay, Carly. Okay, thank you. Such a... Carly, hey. Carly, come here. Come here, Carly. Come here. Hi. She's here. Calm down. Hi. Hey. Hey. Okay, go back in the room. Okay, go. She'll stop. I'm trying to do this, and she needs to stop. No, bye. No, she. Hey, calm down. Calm down. You're fine. Hey. Yes, you're okay. You're okay, okay? Yes. Hi, mamas. Yes, you're fine now. Yes. Oh my goodness.
She probably want to play. We was playing.
Okay, well, play. No barking. No barking. Now she want to get back. Okay. You know what, Sherry? I don't think she's still in heat. I don't know what's going on with her right now. Her little, her little girl things is still a little, I don't know. I don't know if that's how they gonna be now that she had her first heat. I don't know. I don't know nothing. Okay. She's not in heat. Okay. I don't know how the whole heat thing works, but she's not like, there's no like cycling stuff going on, that type of thing. She don't have to wear a diaper no more for that. So I don't know if that means she's out of heat. I don't know. All right, she calm now. She's eating her food. Leave her alone. Let her do what she do. Okay. All right. So we got her calm now. All right. Look, I'm kicking the thing. All right. So today we are doing questions. Hey, Jamaica. So we're doing questions 27 through 34. This is talking about starting treatment. Let me get to my page. All right. Let's see. All right. So some of the things that we're going to be talking about today, we're going to be talking about how does the antiretroviral therapy medicines work. We're going to talk about how do you and the provider choose which regimen is best for you. And we're going to talk about why it's so important to adhere to the medicines, taking your medicine. All right. So, how does the medicine work? So, the antiretroviral medicines, this one thing that the medicine doesn't do, the medicine does not kill or cure HIV. I need people to understand that. A lot of people say, oh, okay, I take this medicine, it's going to go away. There are a lot of people who assume that when they become undetectable, that the virus is gone. Okay. No, it's still there. It's just the virus is not in your body making copies of itself, and you're not able to pass it to anyone else. If you don't understand that, I broke it down in the previous video, and you can go back and watch that one. Hey, good morning, Angela. Good morning, everybody. Good morning. Good morning. Hey, Sheila. All right. So if you stop the replication, you stop the virus from infecting new cells is typically what happens. Suppressing the replication also reduces the immune activation and inflammation that are thought to cause much of the damage to your immune system. Okay? So basically, it keeps you healthy. It stops the damage. It stops the virus from attacking your healthy T cells and things like that. And that also allows whatever damage has already been done to the immune system to actually recover. And it allows you to build those T helper cells back up when you're taking the medicine and it's working. Now we have something also where they called it a combination therapy. Now in the 1990s, this is one of those things where you would have heard it called as a cocktail. You've heard people saying they've taken 15, 18 pills at one time before. That's a cocktail. But listen, let me say this. We don't use the term cocktail anymore. Not very many people. Hey, Deidre. Hey, Leona. Not too many people are using or taking that whole cocktail regimen anymore. So we don't really want to talk about whole cocktail things. But again, the medicine is basically something that's there to help you with suppressing the virus and keeping the virus as low as possible in the body. Not getting rid of it, just keeping it from progressing. Okay? You don't take the medicine, the virus is going to go wild. So that's why it's important. Now, that's question 27. So question 27 says, how does antiretroviral therapy work? Now, question 28 says, should I start treatment? Absolutely. Usually what happens is if you get an HIV diagnosis, depending on where you go, some people go and get tested at like the emergency room. Some people get tested on these little, get your results in 5 minutes buses. But depending on where you go, either they're going to get you started initially with something, or they're going to tell you to immediately go to your primary care physician or to go to an infectious disease physician. Because what they're going to have to do then is they're going to have to find out the right medication that is going to work for you. The benefits of actually starting the medicine as soon as possible is that it is going to keep you from being sick. Period. Like, that is the main thing. If you are HIV positive and you're pregnant, you should also start taking the medicine immediately, because this also gives you that layer of protection. So when it is time for you to deliver, the virus is not passed on to your unborn child. Okay. So another part of this is, okay, what's different from person to person is the urgency to starting treatment. If you've already had complications of HIV, or they give you an AIDS diagnosis, even if just your T cell count is less than 200, you should start taking the medicine, okay? Now, there are some people that we have in the world who are what we call elite controllers. I mentioned this a little bit before. You guys have met a couple people I know who have been elite controllers. An elite controller is someone whose body and their immune system has the capability to fight the virus without them taking any medications. Yes, there are people out here who are HIV positive who do not have to take any HIV medications because their body is strong enough. Thank you, Miss Catherine. Love you. Their body is strong enough to help them fight the virus without them needing those medications, okay? Now, what about if you're healthier and have a higher CD4 count? I mean, it does benefit you and others, but you still want to look at considering still getting the medication, because honestly, any circumstance can happen that can cause you to need the medication. You want to start medicine sooner than later. The longer you wait, the more of those T cells you lose, because the virus is going to take them over. Now, there are some other reasons that you should be starting the antiretroviral therapy medications, regardless of what your CD4 count is. And one of those things is hepatitis B, because you can treat both HIV and hepatitis B with the same medicines, okay? So if you're a person who has a HIV diagnosis and a Hep B diagnosis, it's going to be important for you to start medicine, regardless if your T cell count is high or not. If you have what is called HIV-AN, which is HIV associated neuropathy, because the ART medicine is the only effective treatment. It is. It's the only effective treatment that you're going to get if you have that HIV associated neuropathy. And neuropathy, you know, that deals with the not neuropathy, I'm sorry, nephropathy. Nephropathy. I'm talking about neuropathy, not neuropathy, nephropathy. Nephropathy deals with your kidneys, okay? So if you have issues with your kidneys and you're HIV positive, it's going to be important for you to take the medication, because it's going to help. That's the only way that you're really going to be able to treat it. If you have issues with coronary heart disease, HIV can increase your risk for heart disease, okay? So if you already have issues with your coronary arteries and things like that, and issues with your heart, HIV can increase the risk for you to have heart disease. Thank you. Thank you for those stars, you guys, Miss Catherine. And then regardless of your CD4 count, you also, if you're at risk of a STD, if you're at risk of sexual transmission, you need to start, because lowering your viral load makes you less infectious to others. Okay? Simple. If you're undetectable, you cannot pass the virus on to anyone else. You can't. All right? And then I mentioned it also about the elite controllers. All right, so there are only one group of people with HIV that ART has not been proven beneficial for. Around 1 in 1,000 people with HIV have no detectable viral load, even without being HIV, even without being on HIV treatment. I just talked about this. For them, their immune system is doing the work for the ART in controlling the viral replication. People whose viral loads are undetectable without treatment are called elite controllers or non-viremic controllers. Treatment of elite controllers may benefit them by reducing chronic inflammation and inflammation activation that could cause long-term complications. But since this benefit is still theoretical, most providers don't push too hard if they have a normal or a stable CD4 T cell count. Okay, so I just told you guys that for most people who are elite controllers, they typically don't take the medication. Their CD4, their viral load is where it's supposed to be without those medications. So typically the doctor is not really going to push too hard. The only time that they're going to really consider getting them on those ART medications is if they notice a dip or a change in their numbers. And it really has to be a really drastic change and a consistent change. All right. Question number 29 says, what are the class of antiretroviral drugs and why do they matter? All right, here we go. So HIV goes through several stages in its lifespan, beginning with its entry into your body and ending with the virus releasing new virus particles. So basically new little viruses where it's taking over new T cells and things like that. That's when I showed you guys before the virus life cycle. It goes in, it invades, it replicates, makes a copy of itself, and then it goes and finds other healthy cells to take over and do the same thing. Now, those ART drugs work by interfering with one of the stages in the life cycle. So depending on where your body at or where those cells are once the medicine comes in contact with it is where is going to matter. So this is when you talk about those drug classes and life cycle stages. Now, it does get a little technical, okay? But y'all know I got you. I'm not going to just throw this information out here and make and you not understand it, okay? You know, like me, if you like science and you like all this scientific stuff, this is pretty interesting stuff. I think that's why I gravitated to knowing more scientific stuff about this virus versus just, you know, the basic stuff. Because, you know, a lot of people who are HIV positive, they don't really deep dive into the virus like this. You know, they know, okay, yeah, if you have sex, you need to do this, this, and this. A lot of people only stick to the surface of things. I guess I'm just not one of them people. I like to know it all. I want to go deep down into the scientific part of it. I want to know what this cell is doing it, why it's doing it. I want to know all that. Okay. Now, so the way they do this, and let me make sure I'm looking at this chart. So they list these medicines in different, they're in different classes. Okay. Now, let me see. Let me see. I'm trying to make sure they got it. I'm just checking to see what medicines they got on this. Okay. All right. That's what I want. Yep. All right. So the way they do this, they do these medications in categories, okay? So you have the medications they consider to be, they call them entry inhibitors, okay? These are like so basically with the entry inhibitors, that's the first stage of entry. So this is when the virus is just now binding to, it's just now getting to that healthy cell and it's attaching itself to it. So what this entry inhibitor would do is it would act as a blocker. It would that particular medication would stop it from going any further. Okay, that's what that medication does. Now there's a lot, like there's a lot of different HIV medications. Like there's a whole chart, okay? Just so y'all know, there's a whole chart of these medications. Let me see. I'm just trying to see which ones this chart has. All right. You also have the ones that block the CCR5. So if you ever heard me talk about CCR5 also deals with that protein. So remember I told you that on the surface of the cell, there's a protein. If that protein is not there, then the virus can't invade it. That's like the people that have that mutation that I always talk about, who can't contract the virus. So typically most people have that protein around their cells, so the virus is able to eat at those. So they also have a class of medicines that can actually stop that whole process. It blocks the HIV virus from being able to take away that CCR5 protein that is on the surface of your T helper cells. All right, let's see. Then they also have medications that they consider to be like, you've heard that whole, I mean, with COVID now, a lot of people heard a lot of these terms because when you're talking about infectious disease, you're talking about a lot of stuff with RNA and DNA and things like that. So they have what's called reverse transcription. So basically it turns a viral RNA cell into DNA. It's called reverse because it's the opposite of normal transcription, okay? Because in normal transcription, the DNA turns into RNA. So it kind of reverses it. This, and that's where it takes this enzyme. Y'all, I hope y'all know what enzymes is. I know it's a lot of people don't know what an enzyme is. Enzyme is basically a protein, okay? It's where it takes that's brought into the cell from the virus and it reverses it. That's what it does, okay? You also have medicines that work with integration. This is where the integration is inserted into the newly created viral DNA. And this also gives the cell that protection it needs so that if the HIV virus comes into contact with this cell, it ain't happening, okay? You also have protease inhibitors. Those block the virus in the late stage. That it blocks it in the late stage of the virus taking over a cell. So say you've got a HIV virus cell, it's already went into your healthy cell, is just about getting ready to say, all right, now I'm about to take you over. This protease inhibitor is going to come in there and it is going to block it and stop it right there in its footsteps. And now you just saved one of your cells from being taken over. Okay. So it does get a little deep into the scientific part of it, but the biggest thing is just knowing that there are many medications that you can take that is going to help. It's going to help keep the viruses that you have healthy. It's going to help slow down the replication process, and it's going to help you as time goes. But that goes into one of the other questions we're going to get into, like why it's important to keep taking that medicine. Now, question 30 says, how do my provider and I choose my first regimen? All right, this is where that testing comes into play. Your doctor basically is going to do the testing to find out if you already currently have any resistance to any of the medications that are in the medication tables that they have. First, they're going to look at your RNA and your DNA, and they're going to see what it is that you actually need. What does your body need to help fight this virus? Are you at the stage where you need these protease inhibitors? Are you at the stage where you need the reverse transcription? Which one it is. So they need to know, because they need to know which regimen to put you on. I know for me personally, when I first started taking the medications, they had me on 4 pills. One of those pills was, when I say it was disgusting, it was disgusting because it was called Combivir. And Combivir is one of those medicines that when you put it in your mouth, it immediately starts dissolving. Once it gets touch anything wet, it immediately starts dissolving, and it is the worst tasting medicine ever. You have to literally put it in a hurry up and swallow, or you're going to taste it. And because at the time I was pregnant, every time I attempted to take that medication, it came right back up. I remember one time I was driving and I could not stop in time, and I chucked on the whole dashboard, okay, in the car. So yeah, that was no fun taking that medication. And then the doctor said, you know what, let's switch you over to something else. And that's when I was able to switch over at the time to a medicine they had that was safe for women who were pregnant called Trizavir. Trizavir was the one that they typically, it was the go-to medicine. It was a one pill. And that was the medicine that if you got pregnant at that time, and this was, 2007, 2008, if you got pregnant, this was the one go-to pill that they would put you on because they knew this medicine did not cause issues and side effects to babies. Okay. And so I went from that. Then I went to, after pregnancy, I went to a 3-pill regimen. Then I went to a 2-pill regimen. I've been on 1 pill. I did a triplet at one point. A triplet was probably one of the worst side affecting medicines that I've ever had. I was having crazy nightmares and dreams. It was just, I didn't like it, but it did what it was supposed to do. It had me undetectable, but I just did not like it. And finally, I'm here now. I'm doing my Cabenuva, and now I only have to go and get my Cabenuva injection every other month. Okay? So many advances on that aspect. But it's important for your doctor to know these things. If they give you a regimen and you don't feel right, something feels different with your body, you let your doctor know. Don't be afraid. Don't feel like when they give you something that is what is set in stone and what you have to do and what you have to take. Yes, you have to take it because you want to stay healthy, but if it's not working for you, there's other options. Now, the only time it becomes an issue is if you become non-compliant with your medications and you decide that, all right, I just don't want to take my medicine. Now you're putting yourself at risk for having those resistance to a lot of the medications. So you want to make sure that you are taking those medicines as the doctor is giving it to you. And if you're having issues, talk. That your doctor at this point should be like almost your best friend. Okay? And that's true. I got hiccups, y'all. Hey, LaToya, thank you. Oh, I got hiccups. Go away, hiccups. Because my hiccups is, yeah, they kind of loud a little bit. Need my diaphragm to go back where it belongs. That's what happened when you have hiccups. That means your diaphragm is out of place a little bit. I don't know how that happened. I ain't been doing it but talking. Go back. Oh. All right. Now, before I move on to the next question, another thing I want to talk about, because I was just talking about a couple of these medications. Now, there is a test that they do give you before taking any medications. That there's a medicine called Abacavir. Abacavir is one of the medications that can cause a lot of side effects and allergic reactions. Okay, so there's a test called the HLA-B5701 test. Okay, this is a blood test used to predict the likelihood of the Abacavir hypersensitivity reaction, which is a severe allergic reaction. If the test is positive, you shouldn't take Abacavir. If it's negative, you're extremely unlikely to develop any of those hypersensitivity reactions. Okay, so Abacavir has 4 medicines in it. Abacavir has Zygen, Epivir, Trizavir, the one I just mentioned, and Triumeq. Now, there are a lot of people who, thank you guys for the stars. Thanks, Latoya. There are a lot of people I know who take Trimec. And again, Trizavir was one of the ones that they would give to pregnant women. So, of course, they're definitely going to be checking pregnant women for these side effects before they do that because of, you know, they're pregnant. You're already dealing with pregnancy symptoms. I don't want to be dealing with a side effect either, okay? So that is one of the things to also take into consideration. So you want to make sure that if you're HIV positive, you want to make sure they're doing that test ahead of time. And then also, if there's someone who has a viral load that's over 100,000 copies, the medicine called Epzicom is found to be more or less effective than Truvada in a combination with some of the other medications, because Truvada is one that they typically put with other combinations of medications. So there's just a lot of things. And then you also have dolutegravir, which is another one of the common medications that a lot of people take. Dolutegravir is one that is in Tivicay. What else is it in? And I believe Dovato. Dovato is one of the newer medicines. I want to say Dovato. So that's why you notice a lot of these new medications are coming out. There's less side effects. They're one pill regimens because a lot of people are able to take those. And then they also have a lot of different clinical trials. And if you don't understand what clinical trials are, those are just basically studies in where treatment for a medical condition is tested. You have actual people that come in and they volunteer to determine whether the medication is safe or not. So basically, you know, a medical trial, clinical trial. See if it's going to work. Okay. Let's see here. Let's go to our next question. So question number 31, and then I think we only have about 3 questions left. Why is adherence so important? First of all, what does it mean to adhere? The term used to refer to patients' behavior with respect to following treatment recommendations, including taking medications, keeping medical appointments, etc. So basically, adherence means doing what you're supposed to do when you're supposed to do it. Okay? Simple. That is so simple. Why is it so important? Because when you're not being adherent to the medicine, to going to your appointments and staying in care, you're putting yourself at risk. Not only at risk for getting things like opportunistic infections, but you're also putting your risk at giving the virus to someone else in the event that they come in contact with your blood or your sexual fluids. So you want to make sure that you're staying adherent to this medication. Now, another thing that they talk about here is it says that studies show that your ability to adhere to therapy has little to do with your race, sex, education level, or economic status. Things that do affect adherence are mental illness, which includes depression, drug or alcohol use, memory problems, or just having a crazy or chaotic lifestyle. Because a lot of people try to say, oh, well, I can't stay in the care because I'm black. Oh, I can't stay in the care because I'm a homosexual. Or I can't stay in the care because I didn't go to college. That has nothing to do with staying in care. What happened? Staying in care is a mental thing. If you're depressed, you're not going to want to go to the doctor. You're not going to want to talk about it. You want to basically have an out of sight, out of mind attitude about it. Oh, if I don't talk about it or if I don't go to the doctor to address it, I don't have HIV. No, yes, you have it. And by you not addressing it, you're just causing it to do more harm than good. So that's why it's important to stay in adherence with the medications. Now, they have different ways that can help you get through this hurdle, okay? Many HIV clinics have programs that can help with adherence. You can get a pill box from the pharmacy that has labels, things to keep you on track. You know, your little pill box, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. Fill your pill box up with your medications. If you have one, they have pill boxes where if you take medicine multiple times a day, they have somewhere you can put morning, noon, night. If you like taking it in the morning, put your medicine in the morning. If you like taking it at night, put it in the night box. Like, they have different things like that. You can link your doses to something else you do every day. So, okay, I eat breakfast at about 10 a.m. every day. So before I eat my breakfast or after, let me take my medicine. Before I go to bed, let me take my medicine. Things like that. Add it to your routine. You want to always make sure you're keeping a check on your medicine. You don't want to run out, especially if it's getting close to the holidays or when places might be closed. You want to make sure you got enough medicine to sustain you from the time that place will be closed until they open up again. And you want to make sure that you're talking to your provider or your pharmacist about what to do if you forget a dose. Listen, the biggest thing that they're going to always tell you, when you forget a dose, take it at the next dose time. So say you realize, oh man, I didn't take my medicine last night. I need to make sure I take it. So guess what? You didn't take it last night at 8 p.m. Here's the next day. Take it at that 8 p.m. Now you're putting yourself back on track because you don't want to take it right then when you miss it. And then say you realize at 9 a.m., oh man, I didn't take my medicine last night. Let me take it. You take it. But then what happens? Now you can't take it at 8 p.m. because you've already taken that once a pill once a day at that 9 a.m. So you want to take it when it comes to 8 p.m. so that you stay on that train. Or now you're going to be actually changing the time that you take your medication. And as anybody who knows that takes any type of medication, the doctor is always going to tell you to make sure that you take it the same time every day as best you can. Okay. So now we go to question 32, because I think question 31 is really just that simple to understand. Question 32 says, what if I have side effects? All right. What if I have side effects? If you have side effects from the medication, you let your doctor know immediately, because one or two things can happen. The side effect could be so severe that you might need to go to the emergency room. You do not want to sit at home with a side effect and do nothing. You want to make sure that you are doing something. So if it is a severe side effect, you want to find yourself at the emergency room. If it's not severe, but you're noticing it happen every time you take your medicine, you want to call the doctor, talk to the nurse and say, hey, listen, I notice whenever I'm taking my medication, I'm noticing this happening. Is this something that you know? When you are getting your prescriptions, I know we hate paperwork. I know we hate it. We hate paperwork. But they give you this at the pharmacy every time you go. I'm guilty of it. I don't never read the pamphlet. I don't. They give you this thing and they literally give it to you. It lists the side effects and things you could deal with. We just throw it in the trash. Okay? But I encourage everybody, when you get prescriptions, read it. Just read and grab and look at some of those side effects of the medicines that you're taking. Because there could be things that you're experiencing that you don't even realize is a side effect because you didn't really pay attention to know it could be a side effect. You might be like, oh, this is just a little normal thing. I'm taking my medicine. All right, I got a little scratch here. And that could actually be you being allergic, just not a severe allergy. Just enough that you notice something is happening, but not enough to really be an issue. One of those things. So you want to make sure that you let your doctor know immediately. It's really important. Let's see. Question number 33. How should my treatment be monitored? All right, so once you start on these medications, it's important to get lab tests done frequently, because what happens is this is going to let the doctor know if they need to change your medication, if the medicine is working. It's going to let them know if it's causing any harm or damage to any organs in your body or anything like that. It's going to let you know all of that stuff. So it's going to let you know your viral load. It's going to let you know your CD4 count. So it's important as you start taking these medications, get those labs done. When they say, hey, I need your labs done before your appointment, go get them done. Let me tell you something. There are a lot of times and a lot of reasons why people don't get labs done. They don't like to sit and wait at LabCorp and Quest. Let me tell you the workaround. Are you listening? There's a workaround to it, and it's the easiest thing that you could ever do. Make an appointment. I do not spend no more than 15 minutes or 20 minutes at LabCorp, if that. I make an appointment. I don't care if that 60 or 70-year-old grandma been sitting in here for an hour. I made my appointment, so when my appointment time comes, y'all need to be calling my name. And most of the times they do. We need to start encouraging everyone when you need to get labs done, whether it's at LabCorp, Quest, wherever, schedule the appointments so that you are not sitting there all day. They are going to always call appointments before walk-in. So there should not be a reason why someone should not be getting their labs done. And this is for anything, not just because you're HIV positive. Anytime you need to go get labs done, all you got to do is pull your phone out, log on the website on your computer, schedule an appointment. It takes no more than 5 minutes to put your name, address, find a location, routine lab work, or whatever it is you need to go do, and schedule the appointment. You walk in there around your appointment time, guess what? Your name already on the board. They waiting on you to come and check in. And you can check in anywhere from, I believe it's 5 or 10 minutes before your appointment time. Check in. Sometimes I've had times where I done been in and out before my actual time, because soon as that thing says I can check in, I'm checking in. I'm already at your door. All right. So there's no reason why that should not be a thing. And also with the lab work, they're able to see the CBCs. They're able to see if you're anemic. They're able to see if you're having creatine issues. They're able to see your liver health, kidney functions. They're able to see your blood sugar. All these things they can see through your lab work. They're going to do your analysis to make sure that you're not having any protein flowing into your urine, things like that. All of that. All right, and the last question for today, and then if anybody has questions in the chat and that's watching, you can ask before I get off of here. Last question is question 34 for today. Can my HIV drugs interact with other medications? And the answer to that is yes. Now I will say this. It is less common today than it has been in the past. Okay? It's less common today than it has been in the past. Is it a thing? Yes. There are some medications that you cannot take while you're taking other things. Like I know when I was taking Prescobix and Tivicay before I started the Cabenuva. Now, one of the things with Prescobix and Tivicay, with Prescobix, is that Prescobix can raise your blood glucose. I'm a diabetic. So my doctor had to continuously make sure and keep a check on my blood glucose because the Prescobix can elevate the glucose, but I'm already a diabetic, so I'm already doing insulin and things for my diabetes. So it was just a thing of, okay, let's keep making sure that your diabetic medication is working fine and this is not affecting in any kind of way. So I was okay taking the Prescobix, but it can cause issues. So that is one thing to watch as well. Let's see. So there's a drug called, So there's a level of statin. So this is a drug that lowers your cholesterol. So for example, let me see. The medicine Norvir. So Norvir, I don't know if they still have the capsule. I know they have a pill version of Norvir, but I don't know if they had a capsule version. They used to have a capsule version because I used to take it and it was disgusting. You took too long to swallow the capsule, literally would rupture in your mouth, and it was the most disgusting. It was like a gel capsule. That's one of the medications that can be affected, and when it comes to like taking medications for cholesterol and things like that. Pravastatin, which I actually take Pravastatin. It's a preventative, but because I don't have cholesterol issues, but I have to take it because I am a diabetic. Most diabetics can have cholesterol issues. So some of those medicines, like, you shouldn't be taking it if you're taking certain things. Let's see. Rifamprin is a drug used to treat tuberculosis and some bacterial infections. It affects the levels of most of the I'm getting tongue tied over here. The integrase inhibitors. Those are medicines like Descovy, Genvoya, some of those medications. There's certain steroid sprays that can have an effect. Certain birth control pills. If you're HIV positive, a lot of times they do not want you to take birth control pills. Birth control pills there can be effect back and forth with actually taking like the actual birth control pills. So sometimes they will say, well, we recommend you to get an IUD or we recommend you to do Depo. They're not going to want you to do the pill form of any birth control. Certain narcotics can be an issue. Some of the medicines they have that treat reflux and things like that. There's some calcium blockers that they don't want you to take. Certain seizure medications like Keppra. Keppra is actually one of the ones that's good to take if you are HIV positive and you have seizures, because it doesn't have any effect on your HIV medication. But the other ones, they have some other ones that it does. So yeah, there you have it. That was our questions for today. If anybody has any questions about some of the things we talked about today, which is basically about starting treatment, let me know. You said, can you inbox me? I actually have my inboxes closed, but if you look on my page, my email is there. You can email me. I prefer email because I feel like if you're really serious about messaging me for something when you really need help, you can email me. My email is on my page, ladybirdofficial@gmail.com. Email me because my inbox was just going, like, I was missing very important messages from people because my inbox was full of people saying, hey, what you doing? Like, it was just getting flooded with a lot of things that were just, yeah. So my inbox is closed for 2025, okay? Plus, I have a lot going on that I'm checking my emails more than I'm checking my social media inboxes. I'm in school, I'm working, I'm trying to still do this, so I got a lot going on. So email is the best way to reach me right now. So if you have a question, Latoya, please reach out to me. ladybirdofficial@gmail.com is how you can reach me. And I will get to you. I will respond. All right. So next week, let me see. I got my book right here. Let me see. I just want to make sure next Friday I don't have any appointments. Let me see. Before I say we're going to be back next Friday. Or if I say a time. You know what, Lisa? Lisa told me I got the direct number. Whew. All right. So next Friday. Oh, next Friday I have an appointment. I didn't even write down the time of my appointment. That's crazy. Renee, what is you doing, girl? I didn't even write down my appointment time. I have to call them and see what time my appointment was. I think it's in the morning, though. So we may do... Wait. Yeah. I'm so off on my days. Next Friday is the 24th. This month has moved fast. So next Friday is the 24th. So I will... Let's see. We'll probably do a night one. We'll probably do an evening one. So look for me about 8 p.m. Next Friday. And hey, Michelle. Hello. So we will do, let's see what questions we'll do next Friday. Let's see. So we're going to do questions. All right, we're going to talk about staying on therapy. So staying on the medication. We're going to do questions 35 to 42. We'll do questions 35 to 42 on next Friday around 8 p.m. I'll probably schedule it sometime sometime this weekend or before it when I get a chance to. And then after that, we'll do the other, So we're getting close to being halfway there. Yeah, it'll be 8 p.m. Eastern Standard Time. So, yeah. All right, you guys. If there's no questions that you guys want to ask me while I'm right here now on live, then I'm going to be out of here. I got to come. Yes, Lisa. Thank you guys who sent stars. I know Latoya sent some stars. I know my Catherine sent some stars. Let me see. Thank you guys. Thank you guys so much for those stars. But if there's no questions, I'm going to get out of here. I'm trying to think. Maybe next week sometime. How's Hurricane Michelle doing? Girl, she at school. I had to get her a little Chick-fil-A sandwich for lunch today, child. Thank you, Michelle. So I think what I'll do, I might do it this weekend. It's a 3-day weekend. So I might go live this weekend to just kind of reintroduce myself and meet some new followers the weekend if you guys want to ask questions. Because I know there are a lot of people, a lot of people are hooked on part 15 of my 20-part story. They hooked on part 15, and part 15 has been getting a lot of comments. Listen, I told y'all, 2025, I'm not arguing with people. I just block. So there have been a lot of people that have been getting blocked lately because they have been commenting some really crazy stuff. And I just be like, whatever, block. I had one person, they was like, you taking too long to get to the point. So I was about to respond and say, well, I'm not going to take too long to block you. But then they wouldn't have seen it because I was going to block them. So, so I just blocked them. I was like, man, bump it. I don't get why people act like they can't fast forward. You can always fast forward and rewind replays. Live, not so much, depending on the platform. But you can always, come on now. But it is what it is. But I appreciate you guys for coming on here and spending this little hour with me. Hey, thank you, Sherry. Yes, knowledge is power. Absolutely. Until next time, you guys, I will see you. Might see you this weekend, though. All right. Bye.